So yeah, I've already given away most of what I'm going to talk about, I suppose, in the links. So I guess it depends on how much everybody read. This is intended to be more of a discussion. So please feel free to ask questions or make comments, suggestions, whatever. Um, and if nothing else, I'll be asking some questions. So let's have some fun with this. Have a proper, let's properly nerd out on this. Okay, you know this part. So here we have obviously an axial, sagittal, and coronal view of a chest CT. Does anybody notice anything unusual? Not about like pathology or anything, but just what we're seeing here.
Is it off-centered?
I suppose so. And part of it is, I'm from Radonc, so this is a Radonc image. And yeah, it's definitely not centered the way it would be in radiology. If you notice, like there's actually two tables here. There's a table on a table. And that's because we need an absolutely flat table. And so that kind of just pushes the patient upwards in the image a bit. But that's a good call, but that's not what's, yeah, like about the actual image presentation here. Sorry, trying to be a little more specific.
To me, the lungs look a little dense, and you can also see like I don't know some sort of padding that the patient is on, which I'm not used to seeing in CT.
Yeah, again, this is not a diagnostic image. It's more of a therapy image. But yeah, that's a really good observation. So in contrast to how we probably have seen CT images, you can see almost everything in here. You can see the lung tissue pretty well. You can see the low density padding that the patient is kind of, I don't know, squished into. But you can also see the soft tissue. Like, it's not the best contrast, but you can see, okay contrast between the fat and the muscle. And are you guys able to see my mouse? Great. Yeah, so like fat, muscle, bones, lung. I mean, you kind of see it all. Like you can even see like the spongy bone in the vertebral bodies pretty well. So yeah, this is definitely not a normal CT view that we would see. Now, anybody have any comments about this histogram kind of stuck here in the middle?
Looks to be trimodal.
Well, yeah, kind of. So this is, I guess, if you're going to do a more literal histogram from a regular CT, and notice, yeah, this is not Hounsfield units, but I mean, there's a pretty wide range from 0 to, roughly 2000 or so for a compact bone. Um, yeah, there's a lot of air in this particular histogram. They actually point out the anterior and posterior lungs. I would actually argue this is probably more fat fluid, at least water is supposed to be by definition 1000. And so and then we have a bunch of organs kind of lumped in this peak here, which is a little bit more dense than water because it's got proteins and other stuff in it. And then kind of bone kind of all throughout here. Oops. So if we were to just rescale linearly from 0 to like, let's say 2000, we'd probably get a view like this. And this is probably a little more what we're used to seeing. So the lungs are fairly black. Like we're really only able to see some of the more prominent vessels. And then the contrast between the fat and the muscle is a lot poorer. Ironically, you can actually see the bones reasonably well, but we kind of gave up something. And then, so as you know, in radiology, they like to use these window and leveling, which is just another linear transformation here. So I got these lung and window values from Radiopedia, so hopefully they're pretty representative of what we would normally see in the clinic. So this actually goes technically even lower than air, which is interesting. But it does give us a pretty good view of the lung parenchyma, but pretty poor everything else. And I don't know about you, but on some of my monitors, different monitors, for me, the bone is just completely white. So, and then soft tissue, we're really just focused on that center thing here, the two of the three modes that Ethan pointed out. And we can see the muscle much better. The bones are definitely a lot brighter, but then we've lost the lungs almost entirely. So, and then the bone windows, kind of likewise, good bone. We can distinguish like the interior from the cortical part of the bone much better here. And then so to look at the original histogram and this so-called equalized histogram, we can see there's a lot of dynamic range compression and expansion simultaneously going on. So the high end here is like down here, and then the low end has been pushed upwards. And the idea is you're trying to maximize the amount of information that you're showing. And there's actually a biological basis for this. But in any case, here's a side-by-side comparison. And granted that this is all a compromise of sorts, but overall, at least to me, clinically, the equalized image kind of gives me the best of almost everything. Like I can actually at least try to distinguish the interior, the bone marrow here from the cortical part of the bone, which I'd lose in the soft tissue. Obviously, I get a really good view of the lungs. In fact, you might argue that the view of the lungs here is actually better than in the lung windows. And then, we have at least a compromise on the soft tissue contrast. So you can kind of see everything, which is kind of nice. So again, what do we use histogram equalization for? It's great for dynamic range compression. And it's really nice also because it still preserves the relative lightness and darkness of things. Things that are lighter than others still are going to be lighter. The things that should be darker than others are still going to be darker. So, the relative brightness is still sort of preserved. I found this really great whenever I have like a PDF document that I need to generate. Printing, like obviously we don't print very much anymore, but printing like the dynamic range is even worse. And then we don't have the option to window or level anything. And so it's really nice to give the user kind of a good compromise view of everything. This is especially good for CT because the dynamic range is just so wide. You can still do it for MRI, but it's kind of less important in my experience just because MRI is kind of already sort of perceptually balanced from the get-go. So really all you need is proper window and leveling. Another really great thing about histogram equalization is that it's super easy. It's computationally not hard. This is like you don't even really need any additional dependencies. Probably, if you're doing image processing, you're likely using NumPy if you're in the Python ecosystem. And this is like the only function that you need, and it's really short. There's also one for JavaScript. It's about equally as short. And another nice thing is that this works in n dimensions. So 2D, 3D, technically 4D. You can use this on just about anything. Has anybody ever used this before?
I have not. It seemed I like the use case in particular of when you have to print something or you have to do like a fixed report where it might be useful to include information, at least for visual reference from multiple parts of that range, but you can't fit it all. That seems like a pretty good use case.
Yeah, and actually I used it when I was generating reports for the FDA. So for our clinical or for our performance testing, obviously we have to show scans, we have to show contours on the scans, and it's not very helpful to give the FDA an image of a contour and then there's, it's like all black in that area. They'd be like, what is this? So it was really helpful for that. And they never really commented on it, but I assumed they like it because they didn't have any issues with interpreting the report. So moving on to morphological, excuse me, it's such a hard word for me to say. Morphological operations.
I have just one, I'm sorry, I just have one other question on the,
Yeah,
because I thought it was interesting when you were showing the dynamic range stretching in the lungs, how it looked like there were some visibles that were more clearly there were some structures that were more clearly visible in the equalized spectrum than in the lung window. I'm curious, like what do you is the effect of that something where if you just tightened the range of the lung window, you would maybe see it more clearly? Or like I guess why do you think there's this distinction between those the visibility of those structures?
sure. So despite the fact that we see this line here, what's happening when you equalize the histogram is definitely not a linear thing. So when you're stretching this, like if you were to just, let's go back to the lung window. So, I mean, we're kind of stretching it here, but because it's linear, it's just a proportional effect. if that makes sense. Whereas with this, like it's hard to map because I don't actually have access right now to the actual transformation that was made, but this tail seems a lot longer than if you just stretch this out. Or likewise,
Mm.
even for this, it isn't just, a linear stretching.
Yeah,
And
that makes sense.
likewise, when we deal with a lot of perceptual things, excuse me, we find that there's a lot of non-linearity. So a lot of the things that we as engineers love, we love linearity because it's nice and simple. We, frankly, don't really apply directly very well. And they end up being kind of approximations that work most of the time, but perhaps we could do better. So anybody use morphological operations a lot? All right, sweet. So just as a review of sorts, morphological operations are kind of like a cousin to convolutions, and both of them have what they call a kernel, just sort of like the basis element that we use to process the image. So here we have a box, and here we have some approximation to a circle. Most of the time, we're dealing with a binary element, so it's either on or it's off, which is a bit different, somewhat different from convolution. And in fact, you can implement morphological operations using convolution. And for that matter, for those interested in speeding things up, because convolution can be done in the frequency domain, you should therefore be able to do morphological operations in the frequency domain as well. And anyway, you can do this in 2D, you can do this in 3D, you can do this in ND. So the idea, the way I simplify it for myself is in a morphological operation, you take that basis structure, the structuring element, and for dilation, for example, for every white pixel, you would replace that white pixel with that structuring element. So here we'll do it once, and I'll just kind of go back and forth so we can see the effect. And then we can do it again. We can do it more. We can do it as many times as we like. And one thing to notice is the edges are kind of rounded, and that's because the kernel is rounded. I mean, I kind of liken it to blowing up a balloon. We can go in the other direction. We call it erosion, and it's really just the reverse of that. So you treat the black, for every black one, every black pixel, you replace with that kernel. So we can go back the other direction. Now, theoretically, we'd be back where we started, but clearly we're not. So the inner edges, the inner corners have been rounded off. The outer corners are still sharp, and we call this a closing. We'll talk a little bit more about this in a little bit. So if we keep on going, and then we go backwards, we have what we call morphological smoothing, where you can see both the inner and the outer corners are now rounded, and kind of a back and forth to kind of see that. So again, a closing is a dilate, then an erode. It smooths the intrusions into a shape. We have opening, which is an erosion, then a dilation, and that smooths the protrusions. And then we have a smoothing, which is when you do an opening or closing and then an opening. So kind of, I guess, hopefully not a hard question, but how many morphological operations do you need to do a smoothing? Any
4.
takers? 4. Sure, yeah. If you use the same kernel or structuring element, then yes, it would be 4. You do the dilate, then erode, dilate. But you can actually combine these two erosions into a larger single kernel or structuring element. And then you could kind of cheat and just do one dilate, one twice as big erosion, and then one dilation again.
Kris,
And
I
yes,
have a question about that, about the hack, or I guess it's not a hack, but like the strategy of using a larger erosion. When you say a larger like kernel, if you go back a couple of slides, could you like demonstrate, yeah, this slide, could you demonstrate like what would a larger kernel mean? Would it mean just like this multiplied by 2 or like squared, or how
so
would that look?
for sure. So for example, if we like, let's just say we're not going to do like a whole bunch of them. So if you did, you could do a dilation by this, and then so this one you don't really count the center, so this would be 2 extra, so this would be 2 and this is a 1. So I would do one with this, one dilation with this, and then an erosion with this, and then another dilation with this one.
Gotcha. Okay. Yeah, that helps.
So yeah, so this works in 2D and in 3D. I guess you could do 4D, but I've never needed to. So other fun tricks, like, so I just took this from OpenCV because they had some really nice examples. So if you have speckled noise, you could do an opening and then potentially remove it all depending on whether your kernel is big enough to catch that. One thing I would caution you on is that the shape isn't exactly preserved. It's somewhat minor in this case, but for this, the dot of the eye, it's definitely not what it was before. So if you really require something not to change its shape, I probably wouldn't pick this method. But if you just need something quick and dirty and close enough, then maybe this will work. Likewise, in the reverse, if you have holes in your image, you could use a closing to close them up. And likewise, the same warning kind of applies. You can kind of see the intrusions into this J have been rounded out. So again, if you absolutely need shape fidelity, this is probably not the best way to go. And lastly, you can do both and subtract them, and you get the outlines of something. And one might ask, why in the world would I ever need to do that? But it turns out in radiation oncology, sometimes we do. This is an example of a prostate treatment. And so this is the prostate here. This is the bladder. Oops. And this here, this long elongated structure is the rectum. And as you can see, we're going to blast this prostate to a pretty high dose, and the rectum is sitting right behind it. And over the years, there's been some debate over how we should contour this structure, because the easy thing and the standard thing to do would just be contour the whole thing. But we honestly don't care how much we radiate what's inside the rectum. We really care about the wall of the rectum. But some protocols, research protocols might ask for this for now that we're hyperfractionating our treatments a lot more, which means we're treating with fewer treatment sessions, but each treatment session gives a more whopping dose. It's kind of coming back into fashion where we kind of want this wall structure. This isn't always offered by treatment planning systems. So it's not a hard thing to implement, and it's a little extra thing that we could do. We commonly use these operations to expand or shrink contours for margins. So here is a screenshot from an older version of Eclipse, which is a treatment planning system. And you can see they actually allow you to define different distances for the different major directions. Does anybody have any idea how you might implement that? So far, we've been talking about symmetrical structuring elements.
Be like a non-square or non-equally distributed kernel.
Yeah, that's exactly right. But the trick is, how do you do that in a smooth way? Because we can't use a cubic or square box-like one, because then we'd end up with some really large discontinuities. We'd end up with sort of like 8 cubes stuck together. And that's okay. Yeah, we don't have to know. We can leave this as an exercise for the reader. But clearly it's been done. Some TPSs do use this as a smoothing operation. And yeah, you can make shells of contours this way. So moving on to perceptually uniform color maps here. How many of you folks have used perceptually uniform color maps? No? Okay. So I'm kind of curious, what color maps do you guys use the most frequently? I mean, besides grayscale.
Pretty much grayscale all the way, in case unless it's the black body radiation one. And I think the only reason I do that one is because it's the default.
Okay. Fair enough. So color mapping, yeah, I guess we don't think about it very much, but like for radiology, it really is the standard to color map some sorts of images like PETs. Functional imaging is almost always color mapped in some way and usually overlaid on a grayscale image. The color map has gotten more attention as something we should probably pay attention to from a usability perspective. So here we have examples of, at the top, we have the MATLAB favorites, Jet and Hot. And then down here, we have more perceptually uniform variants called Rainbow and Fire. They really love interesting names. So Jet is originally, I think, from maybe JPL, I think. And then I don't even know where hot comes from. But these were really created with like programming ease kind of in mind. I mean, this is just straight like pure blue, pure green, pure red, etc. And what we're looking at is something called a sign grading plot. Has anybody seen these before? Okay, great. I feel good that I'm not talking about something you guys already know. So at the bottom is just the plain color map. At the top here, we have slight perturbations in the level. So what we're looking at everywhere is sort of like, can you see a difference in that gray level versus its nearby neighbors? So in a perceptually uniform color map, we should be able to see these lines pretty much uniformly throughout the range, such as we do here in this grayscale plot. The problem is that some of them will have kind of like these almost like blind spots where you can't see these lines anymore. And so what this means is in this range, you actually will have a hard time telling the difference between this intensity and this intensity. Or even worse for this one, this intensity and this intensity, which is actually pretty different. It's like almost, I don't know, an eighth, 10th of the color scale, where you can't even see anything. Likewise here, this is a modified HSV, which is a rainbow-like one. Yeah, like, I don't know, you wouldn't be able to see much of anything in this region nor in this region. On the flip side, I don't know about you, but I kind of see like a line here. And when you're viewing data, it can look like an artificial feature that doesn't actually exist. So this potentially has some usability and risk attached to it. And probably about, I don't know, 10 years ago, people started recognizing that color perception was actually kind of important. So they actually started to model human vision and how we perceive colors and brightnesses and kind of bake them into color maps so that, you know, these two ostensibly are pretty similar and so are these, but if you pick the right brightnesses and the right hues, you can actually start to minimize these problems. Does it matter? Yeah, kind of does. So you can see by the age of this, 1996, and from IBM, the most innovative of places, they caught on to this. They're clearly not radiologists because the heads are facing the wrong way, but still standard jet. I can't even see anything in this whole area here. Whereas the grayscale, oh yeah, now we know what we're missing. Does it matter clinically? Well, there's not a whole lot of data in this area, but one of the more recent articles from 2019 is actually done by a couple people from the FDA. So it's kind of an important topic for them. And the answer is yes, it does matter. So what they did was they studied grayscale, hot, and rainbow, which I'm thinking is probably jet. And they did myocardial CT perfusions, asked radiologists to find the underperfused areas. And then they also did prostate MRI, apparent diffusion weighting, and they asked radiologists to find the tumor. So in this use case, they saw a statistically significant difference in the AUC for detection of underperfused areas between grayscale and particularly rainbow. This doesn't look like a whole lot of difference, but this is actually almost like a 20% difference. So I would argue that that is clinically significant. So from like in the mid 50s to the upper 60s. So clearly perceptual uniformity here paid off. And now, unfortunately, this didn't really pan out in the prostate detection one, and it's possibly because maybe it was already obvious and it didn't really matter. But nonetheless, I think it's safe to say that being perceptually uniform was definitely not a detriment. Do we have any colorblind folks in the group? Nope. Okay. Well, I looked it up and there actually are colorblind radiologists. Maybe not completely colorblind, but at least partially. And so these are folks that we should probably also try to accommodate. These are renderings of the common MATLAB color maps. as perceived by different types of partial color blindness. And you can see the closer you are to perceptual uniformity, the better it looks. So definitely grays, obviously. Gray and bone don't change. Even hot didn't do that badly. And that's just because the perceived brightness is at least, in line with what we expect. But then other color maps get kind of confusing. Like here, we have a real perceptual dead spot in both the yellow and the blue zones. Same here, kind of here and here. So, and then there's also all sorts of color maps we can use for just because it looks cool. So, particularly for 3D rendering, it's just a fun thing to do. And it was kind of fortuitous that Matt had mentioned dealing with Terra Recon a little bit earlier in one of the other channels. I think they kind of had their claim to fame starting with 3D renderings of things. Out of curiosity, is that something clients ever seem to care about?
Terra Recon or 3D rendering?
3D rendering, sorry.
It's,
I'm sorry,
it's pretty
Bimba.
hard to it's hard to hear you, Bimba. I think maybe your mic is not working or something.
Oh, sorry. Can you hear me now?
Yeah, I can hear you now. But
Yes. Yes.
Oh, okay, cool. Yeah, just saying, I don't think I've had it come up in a client project, so I think substantial to contribute there.
Sure. Yeah, I imagine particularly for online or web-based applications, I don't know, maybe it's more challenging. I don't know. But yeah, you can get really creative with color mapping. This one was from a paper talking about turning volume renderings into something more pleasing perceptually, mostly for the purposes of education, possibly surgical planning. It's just easier to imagine, like, I really am looking at a patient. And they take advantage of that, the fact that Hounsfield units tend to be associated with different kinds of tissues, as we saw earlier. Here are a couple other versions where you can make pretty pictures playing with color maps. So this was a CT with contrast. And if you arrange your color map right, you can pretty much just get rid of most of the tissue and look at, I guess, at what is most important, the major organs, major vessels, bones. And likewise, you can do the same for the lungs, and you can really see the tree of the lungs here. It's kind of neat. So in my practice, I really like to try to use perceptually uniform color maps whenever possible. I do think it's worth having that discussion with clients. Like for one project, I brought it up with the client and they said they actually considered it, but then when they asked the doctors what they had preferred, the doctors actually preferred the non-uniform maps. Um, and I think a lot of it is visual appeal versus can I distinguish the data here? And it's really easy to, especially if you don't even know that it's happening, it's easy to go for the perceptual appeal. Try to keep people with color blindness in mind when we manufacture our devices. And, it's okay to have something that's not perceptually uniform as your default. If that's what people like, it's okay to have it. But I do think it's important to offer a selection or to make it customizable so that those people can be accommodated. For PET, I definitely recommend Viridis or Inferno. Inferno is very heat-like, so it's very natural for radiologists to look at. They probably won't even know that you had switched it up, but the ability to distinguish different levels is definitely better. And then for CT and MRI, it's hard to beat the good old-fashioned grayscale. So thanks for listening. I'm curious to hear what sorts of image processing techniques are, standbys for you guys.
Great presentation, Kris. It's awesome.
Yeah,
Thank you.
this is sweet. I was just going to say on that last color map stuff, I didn't have anything specific to point out, but I was curious if you'd heard about I think it was the JET. There was like some controversy that involved NASA and Google and how they discovered that people were, I don't know, JET had, I think, not being very accessible to colorblind people seeing like fake patterns in JET in particular was, I don't know how much of that is true for medical imaging, but do you know anything more about that? Or is it like pretty safe to recommend avoiding JET more or less whenever possible?
I think it's okay to use a rainbow-like one, maybe not JET. Yeah, partially because of the potential for seeing features that aren't there, like like you can here. Unfortunately, this is sort of a soft area, and even studies like this are hard to come by because it is such a subjective thing. But again, I would point out that perceptual uniform maps do not underperform compared to jet, despite how aesthetically pleasing it may look. So there's definitely no downside to going with that. And there's definite, I mean, it's not definite, but there's potential for risk mitigation if you do use them.
Gotcha. Yeah. Yeah, those 3D renderings look awesome.
Oh, thanks. One was from a paper. Yeah, this is from a paper. So, and it does look pretty cool.
I've heard about perceptual uniformity, but this one I hadn't seen the sign grading thing, and just seeing visually, I think that really just made it pretty apparent. I kind of understood the importance, but never really kind of, I guess, visually understood it until I just saw this. So that was really interesting. Thanks.
I wanted to say that a lot of these terms and things I had heard and knew a little bit about, but I feel like a lot of things just clicked for me seeing everything all together. So kudos on that. I did have a question. So kind of along the lines of designing for accessibility, I'm curious if if much research has been done into how external factors affect perception, because I could imagine things is an OLED versus LCD screen, or the type of lighting that is in the environment the person is viewing images, all of that could affect perception.
Yeah, they can. Yeah, certainly this quality of your screen does matter. Now, whether the display technology itself, I don't think anybody has studied directly, but definitely when it comes to the actual monitor performance, for example, what do they call it? The delta, I forget the letter. But anyway, when they calibrate monitors and they certify them for medical use, they definitely have a standard that they need to meet. And it kind of makes sense that the display technology itself doesn't matter that much, because if they're already measuring the output, they're measuring the output, and that's what goes to your eyes anyway. That being said, maybe in the future, like for LCDs, viewing angle does matter. No matter how good your LCD is, it still matters. So in that respect, maybe OLED or micro LED might be superior in the future, barring burn-in.
I noticed I had never noticed this feature in iPhones before, but I was helping my grandmother with her iPad and just going through all the accessibility settings to turn on some stuff. And I noticed that one of the settings that's in there is that it will adjust the color tone of the display based on ambient lighting conditions to try and make the perception of colors more uniform in different lighting conditions. I thought that was really interesting. I'd never seen that setting in the iPhone before, but it definitely did make me more aware of depending on the lighting conditions, especially really dramatic lighting conditions, if you're in a place that has red lights on or something, or something really skewed non-natural light coloring, it can really change how everything looks. So I thought that was pretty interesting to see that they built in stuff just for the perception.
Yeah, Apple is really on top of those issues, and it kind of sets them apart from most other hardware manufacturers. And I definitely give them a lot of credit for that. And I would say that's a great point. I think for medical devices, there are a lot of these little, soft touches that I think could really make, individually, it might not seem to make much of a difference, but I think overall, if you have enough of them, it will add up to a perceivable difference in the quality of the device. I mean, we see this with cars all the time, right? What's the difference between a Lexus ES and a Camry? It's they have the same platform. They use a lot of the same parts. You can go to either dealership and get them repaired, right? But one of them commands a higher price, and one of them is generally seen as better than the other. And I definitely think that easily applies to medical devices. I think we've all used something that's really refined and then something that's clearly not.
I think one thought I had when you were talking about morphological operations and how they're just one form of or I forget what you said, but they're related to convolutions, right? I'm wondering if in like the context of deep learning, where is it still, do you know if there's research out there that is it still beneficial to explicitly do like morphological operations for pre-processing, post-processing, or because if, like convolutional neural nets, I would think because it's just convolution and it's related to morphological operations, it would just capture anything productive you'd want to do with morphological operations just in the, in the black box. So like, is it still even beneficial to do any of this morphological pre-processing or would it just be better to just like let the black box kind of figure out? I don't know.
That's a good and fun question to think about. Like in the end, I'd have to say, I don't know. But it would make sense to me that the cleaner the cleaner the data you can provide, either during training or inference, seems to me that that would be the right thing to do. And I don't have any hard evidence regarding AI, but I would say just thinking about how human vision works and how we perceive things, there's a lot of pre-processing that happens before that signal from your eye gets to your brain. And even then, before it gets to the conscious part of your brain. And so to me, at least that at least suggests the more you can clean it up before it gets to the important processing, the important inference step, the better off you'll probably be.
And in the context of neural nets, like with that, like normalization layer that usually you encounter, like I guess if your data is it's not, yeah, the purpose of that thing is to normalize it, but also if your input data is very, very non-normalized, I guess you can add, enough variance, or to the model, I guess, and I guess you want to prevent that too.
Without knowing anything about the model, I would say probably yes. Like when you think about even histogram equalization, it's kind of a weird thing because you're increasing the contrast between a lot of things. But at the same time, it's also compressing things too. And it's trying to it's trying to maximize the amount of information being conveyed, but without actually changing the data, which is kind of strange because histogram equalization is actually reversible. So if you know, you can actually get the transform that maps brightnesses from A to B and then reverse and get back to A without any loss really. So you're not actually losing information, but you are presenting it in a different way. I don't know if that answered your question, but that's a really interesting area.
Yeah, it's pretty, yeah, I'm really curious to see if there's any stuff, because I would imagine, like I know morphological operations before deep learning became as popular as it was very useful for like noise reduction. And I'm guessing like all that sort of stuff is still worth doing as a pre-processing step. Like even if the neural net captures that anyway, like it just would not hurt, clean the data, like you said. It's like I can't imagine that hurting, only helping.
Yeah, I've seen it used quite a bit still for like the post-processing of the masks produced from segmentation. Like even recently for a client project, just to because even like the edges like far away, like let's say you have a volume and like your primary thing that you're trying to segment is in the middle. Like there's almost usually like no matter how great your model is, there's gonna be like some kind of like spurious thing like way over here by the feet, let's say, that you want to just like clean up and don't want to contribute towards volume counts and things like that. In my experience, so I feel like it's still used morphological operations for post processing. The segmentation masks is used quite a bit. I mean, but it's definitely context dependent. If you have the world's greatest model trained on all the data in the world, maybe you don't need it.
Yeah, no, that makes complete. Yeah, if there's just like a tiny misprediction in the corner somewhere, yeah, that feels like something that's purpose designed for this.
Yeah, it just tells you how weird models like AI models are, because I think if I doubt, like for in Matt's example, like do you think a person would ever make a mistake like that?
like say there's a liver lesion in the foot or something. No, probably not.
Yeah, or like you said, like you have all these ditzels like elsewhere and stuff like that, and there's all this cleanup necessary. Like, do you think those are errors that a human would make?
No.
Probably not any, yeah, probably not those mistakes. Those seem pretty unique to neural nets.
I mean, I have seen it where a person was doing an annotation and then they just like clicked off to the side and made this little island of, a label, which was, error or something. So it does happen, maybe not in the same way.
And a tiny one that unless you're running code on top of that mask, you probably won't find it.
So something I guess related to maybe not model quality, but just like approaches. Maybe you're doing something like you need to break apart instances, and you don't have the data like annotated to do something like instance segmentation. So you have like two, let's say, I don't know, teeth abutting, and your mask touches, and you need to do one of these morphological operations to try to kind of split them apart, like those kinds of things. So it's definitely still a good tool to have in your tool.
Agreed.
Another thing that's I wanted to mention that's useful is like the histogram normalization or histogram matching, sometimes it's called, to take data, a large set of data and make it more similar. It's not necessary as much with CT, but maybe for something like MRI. Like MRI, the pixel value, like the intensity value, doesn't necessarily have a quantitative meaning to it. If you image the same patient with two different MRI vendors, like those values are going to be very different for like the same region of the body. So sometimes as like a pre-processing step, you would do histogram normalization, where there's usually a linear function, but a way to match the histograms for each series across vendors so that they look more similar. That's pretty important for like quantitative analysis if you're ever using like the intensity value of an MRI image, which maybe is frowned upon, but sometimes that might be necessary. So the ability to normalize those intensity values is really important if you're using data from different MRI vendors.
Very true. On that note for MRIs, and I didn't cover this topic, but has anybody ever used homomorphic filtering? So in MRI, because it's based on this magnetic gradient, sometimes you have inconsistencies in this gradient. So has anybody ever noticed that like the center of the image is usually brighter than the periphery, and it sort of looks like you've got a flashlight looking down on the image? Yeah, and so like if you were to take an intensity profile across the image, it would kind of look like that. And that will really screw up anything quantitative that you might want to do. So in addition to the definitely not replacing histogram normalization, you can use homomorphic filtering to try to use frequency space filtering to try to even out this low frequency component, because like something like this is extremely low frequency, whereas like the details in the image are very high frequency. So if you can selectively remove the low frequency portion, you can kind of even out this gradient, and then you're still left with like all the detail.
Is that what they sometimes call bias field correction? I've seen where
I don't think so, but I would have maybe that is what they call that.
I think that might be, this is like really, I don't remember, but I think that might be something else.
Or is it like homomorphic filtering is a method to achieve
That
bias?
maybe.
My impression is bias field correction is more about the actual like geometric distortions that can occur, but not necessarily the intensity alterations. But
There's one other comment I wanted to make. This is backtracking a little bit, but on the topic of color in terms of managing risk associated with the use of color. And this might be obvious to everybody already, but I think this is probably one of the cases where we run into risk with color the most, is using red to indicate an error condition in an application. We run into this all the time, and especially if you're using it as a risk control measure, that like, hey, if there's a value the user needs to pay attention to, we're going to highlight it by making it red. That doesn't work for colorblind users, and so that risk control measure isn't applicable to some portion of the user population. So using color alone as an indicator of something important you need to communicate to the end user generally is not sufficient. You need to have like some sort of secondary way to indicate that some information is extra important. just want to mention that because I think it's something that it's like a pretty mundane use of color, but it's also like, I think we run into it a lot, so it's worth bearing in mind.
Just to
That's a
tack
great
on
point.
to Reese's point, that was a big discussion that was had back when I worked in manufacturing with these big pieces of manufacturing equipment. It was really important to service different people with different disabilities for the differentiation between just a notification, a warning, and an alarm, because depending on the severity level of what those were, you either it's just trying to inform you of something, you're causing damage to the device that you're working on, or you could incur bodily harm from it. So it was like a huge discussion as a part of our DRM training to ensure that when you're giving the user information, to make sure that it's done in a way that services everyone.
Mhm.
Well, hopefully, if we have submissions that have either of those two people from the FDA and that paper, we can make them happy. All right. Thanks so much, guys.
Yeah,
Thanks,
this
Kris.
is
This was a great talk.
I feel like in the age of deep learning, it's nice to see like old school image processing stuff. So yeah, thanks for the presentation.
Thank you.
See
See
y'all.
you guys later.